Hello, my name is Ariana, and I am here today to explain and administer the Mann Assessment of Swallowing Ability. The Mann Assessment of Swallowing Ability, or the MASA, was designed by Giselle Carnaby Mann for use in bedside evaluation of patients referred for swallowing function assessment and dysphagia concerns. The MASA is a quick and reliable screening tool that allows clinicians to evaluate patients and determine which ones are true candidates for more involved instrumental evaluation. The MASA may also be used to monitor swallowing skills over time. It includes a technical manual and step-by-step guide, which includes information on how to use the tool for data collection, monitoring patient status, and other clinical applications. The MASA includes 13 pages of areas of assessment. These include alertness, cooperation, auditory comprehension, respiration, respiratory rate for swallow, dyspraxia, dysarthria, saliva, lip seal, tongue movement, tongue strength, tongue coordination, oral preparation, gag, palate, bolus clearance, oral transit, cough reflex, voluntary cough, voice, trachea, pharyngeal phase, and pharyngeal response. The MASA will now be administered. The patient's level of alertness, cooperation, and auditory comprehension, as well as the presence of dysphasia, dyspraxia, and dysarthria, can all be assessed informally through conversation. The patient's respiration and respiratory rate after swallow, as well as the presence of a tracheostomy, information which can be gathered through the medical officer, pulmonologist. Hi, Miss Hewitt. How are you today?
Good.
How was your 4th of July?
It was good.
What did you end up doing?
I went to the parade, and then we went to my house and watched fireworks.
That sounds fun. All right, so today I'm here. We're going to do a little bedside evaluation with you. Does that sound okay?
Mm-hmm.
Just want to ask you if you've noticed any saliva after you eat or drink or just going about your day, leaking out of your mouth. Okay. All right, so now I want you to say the vowel E and spread your lips as wide as you can.
E.
Now do that with the sound oo.
Ooh.
Good job. Can you alternate between those? So say E, oo, E, oo.
E, oo, E, oo.
Okay. Now I'm going to give you a spoon, and I want you to close your lips around this spoon. Good job. Okay. Now can you blow air into your cheeks? Good. Okay. Now can you stick out your tongue as far as you can out of your mouth? Good job. And now stick it out and then bring it right back in. Good. Can you do it on the sides of your cheeks like this? Good. And now stick it out of your mouth and go from side to side. Good job. Okay. All right, I'm going to put the spoon right here in front of your mouth and stick your tongue out and try and push against it. All right. Now try and reach the side. Okay, and other side. Okay. Can you lick around your lips for me like this? All right, and now do that as fast as you possibly can. Okay. Can you say the word, can you say the sound T?
Ta.
Okay, and repeat that a few times.
Ta, 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 ta.
Good. Now can you repeat after me? Take Tim to tea.
Take Tim to tea.
Good. Now we're going to try it with the sound K. Can you say K as fast as you can?
Ka. Oh, ka, 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 ka.
Good. Now can you say, can you keep Katie clean?
Can you keep Katie clean?
Good job. Thank you. Okay. Now I'm going to give you this cracker, if you don't mind just munching on it for me. Okay, and then swallow whenever you're ready.
Okay.
Okay. I'm just going to open your mouth wide for me, please. I'm just going to check and see. Okay. Looks good. Can you produce the sound ah for me as strong as you can?
Ah.
Yep, and now just hold it for as long as you can.
Ah.
Thank you. Now can you repeat ah several times?
Ah, 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 ah.
Good, thank you. All right. Now I'm just going to check. This is what's called your oral transit. So I'm just going to take my fingers and stick them under your chin. Can you swallow for me? Good. Typically that takes about 1 second, so that seems good. Okay. Now can you cough as hard as you can for me? How did that feel? Pretty good? Okay. Can you say ah but slide up and down on a scale for me like ah?
Ah.
Good. Now say the sound s. And now with the sound z.
Z.
Thank you. We're almost done. Okay. Can you swallow, pant 3 times, and then say ah?
Ah.
Good. Now can you turn your head to the side and say ah? And the other side? Thank you. And can you lift your chin and say ah? Good. Okay, that's it for today. I'll see you in a few days.
Thank you.
Each area of assessment is graded on a scale between 1 and 10. Once completed, the clinician will tally the total number of scores and include any additional problems as well as a summary of the assessment. Recommendations can also be made based on diet. Diet recommendations can include grades of solid and fluids and whether the patient can be per oral or nothing per mouth. The clinician will also grade the swallow integrity of the patient once assessment is complete. Once scoring is complete and recommendations are made, the clinician will then provide a diagnosis with a severity rating from mild to severe.